confirming today that the cause of an illness outbreak at the University of Michigan campus in Ann Arbor is from the norovirus. We first told you about this earlier this week. It's sickened 100 students.
And our chief health editor, Dr. Partha Nandi, joining us now with ways you can protect yourself from the norovirus. We've seen this on other college campuses around the country. Now here.
Yeah, as you said, Curtis, more than 100 U of M students have sought treatment over the last several days. The 6 students live in either the South Quad dorm or West Quad, which is right across the street. Now, the university says both dorms share the same dining hall. And here's what I would say you can do to protect yourself. Here are my prescriptions. Number one, we've said this all the time, wash your hands frequently. For Michigan students, you can sing the Victor song, so that takes about 20 seconds, and while washing your hands with soap and water. So do not share drinks. Be smart about not catching unnecessary sickness. Just common stuff. Clean and disinfect surfaces, countertops, tables, and guess what? Your cell phone. That cell phone can carry a lot of stuff. People think it's so clean. Also, avoid infected people. Keep yourself in your dorm room or your room if you're sick, or head home to prevent getting your roommate sick. So, it's important to follow those principles. I know Glenna gave me a look because I said the Victor's fight song for U of M, but whatever fight song you like.
Thank you, Doc.
Whichever one works for you.
So what are the symptoms for norovirus? Do they have any that are specific to
Well, it's pretty non-specific. It's kind of like you get your nausea, vomiting, abdominal pain, and fever. But in this setting, it's one of the most common, probably the most common cause of gastroenteritis in the United States. So it's important to know what those are.
How contagious is it?
Very much so. You can get it from infected people, from surfaces, from water, from food. So very, 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 very contagious. That's why people really need to wash their hands, things that we talked about just a few minutes ago.
All right, so switching gears a little bit, we have a viewer question. They're concerned about a report regarding PPIs and dementia. Can you talk about it?
Yes, the PPIs are things like Prilosec, Prevacid, Protonix, very common. And so here's, a lot of our viewers are asking the same question, is it safe? Because what's happened is that it's been shown to have an association with dementia. I'll say association. What's been reported and people think is it's a cause and effect. And so people think if I take this, I'm going to get dementia. Very, 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 very clear to be is that it's an association. It's a German study. They looked at insurance records of patients that were over 75 years of age, 73,000 patients, and they found out that people with PPI seem to have more dementia. Now, it's an association. You can make the same association if you wear blue jeans and say, if you wore blue jeans, you have dementia. So I'm not saying to discount it, but it's not a cause and effect. So key is use the medication as your doctor says. Talk to your doctor. Say, listen, do I need to take it? Because I saw a study. If you don't need to take it, don't take it. But if you need it, it can really help you.
All right. Thank you, doctor.
My pleasure.
And if you have a question for the good doctor or a health concern, you can email him at drnandy@wxyz.com or send it to us on Facebook or Twitter.